day. I welcome you to another Ministry of Health virtual media conference on the national COVID-19 response. Today we have with us Dr. Roshan Parasram, Chief Medical Officer, Dr. Robin Sinanan, Medical Director, Secondary Care Services at the Southwest Regional Health Authority, and Mr. Keston Joseph, Disaster Coordinator at the Southwest Regional Health Authority. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator this morning. We begin with the clinical update from the Chief Medical Officer.
Hi, good morning. Thank you, Ms. Alcantara. Good morning to Dr. Sinanan, Mr. Joseph from Southwest Regional Health Authority, members of the media, members of the viewing and listening public. So we'll begin with the clinical update for 19th of November 2021. The total persons tested at both public and private facilities now stand at 428,214. The total new positives over the last 24 hours, 491, taking our total positive caseload since March 12, 2020 to 64,893. Our total recovered patients so far, 54,798, leaving an active caseload of 8,176. Persons in home isolation, 7,073, and deaths now stand at 1,919, and condolences to all of those families who would have lost loved ones since the beginning of the pandemic. In terms of our hospital occupancy, we now stand at 503 patients in hospital, 109 in step-down, 92 in state quarantine facilities. By way of a breakdown as it relates to the hospital facilities, Couva Hospital and multi-training facility, 98 persons, 26 of which in ICU, 24 in the high dependency unit, Cora Hospital 66, Augustus Long Hospital 42, St. Anne's Hospital 60, Arima General Hospital 63, New Point Fortin Hospital 79, St. James Medical Complex 55, Scarborough Regional Hospital Fort King George 36, Scarborough Regional Hospital Signal Hill 4, and those in step down at the UWI Debe facility 58, UTT Valsine 21, Field Hospital Port of Spain 18, Field Hospital Couva 5, and the Tacarigua facility 7. By way of our vaccination figures, to date, as of yesterday 4 p.m., 636,097 persons receiving the first dose of a 2-dose regime. In terms of our single dose, 40,299, and our total persons in terms of completed vaccination regimes, 633,341. By way of our persons receiving additional primary dose, we now stand at 9,289. Thank you, Mr. Alcantara, to give the clinical update this morning.
Thank you very much, Dr. Parasram. And we go now to a presentation from Dr. Sinanan, who will give us his experience on the ground during the COVID-19 response.
Good morning to the panel, members of the media, and to the viewers at home. When you come in to the emergency department, the first thing that happens is you must be triaged. We use the Canadian Triage and Acuity Scale, something called CTAS. This system has 5 categories, which represents the severity of the patient's condition. Categories 1 and 2 are very ill persons, while categories 4 and 5 are non-urgent. What we've been seeing over the past couple of weeks is that more persons are coming into the viral pathways at the emergency department at CTAS levels 1 and 2. They're much sicker than before. So while the overall number of persons has been increasing as we spike, we're actually seeing a higher percentage of very sick persons. Some days it's up to 20-25% of the persons who are coming into the emergency department. These persons, they frequently require immediate oxygen therapy, either from masks or nasal cannulae. Some even require that we place them immediately on a ventilator. A common factor in these cases is that patients seem to be waiting too long to come into the hospital, sometimes as much as 2 to 3 days. And also the vast majority of them are unvaccinated. So what I would like to advise the members of the public is watch for your symptoms. Just to recap some of the common COVID symptoms, which can appear from 2 to 14 days after exposure. So you have milder symptoms, fever, chills, cough, mild shortness of breath, fatigue, body aches, nausea, vomiting, diarrhea, sore throat, runny nose. If you have any of these mild symptoms, get tested. However, older patients and persons with underlying medical conditions such as diabetes or ischemic heart disease, they're more likely to have severe symptoms. Now, what are some of the warning signs that people need to look for? Trouble breathing. Now, what is that? It's a little complicated sometimes. So if you're breathing faster than normal, if you feel as though you're suffocating, or you're not getting enough air into your lungs, or if you have a pulse oximeter and the reading is below 90%, you need to contact your ambulance. Other symptoms that are warning signs would be severe or persistent chest pains, new sudden confusion, drowsiness, severe weakness. Now, these are just some of the common ones, but if you're experiencing any of these, call 811, the ambulance service, immediately. The take-home point I want to leave with everyone today is that look for your warning signs. Call your ambulance. Don't wait until it is too late. Thank you all.
Thank you very much, Dr. Sinanan. And now we go to Mr. Joseph, who will tell us some of the arrangements that have been made at the Southwest Regional Health Authority as we put preparations in place to escalate the response.
Good morning to the Chief Medical Officer, Dr. Pasaram, my colleague, Dr. Sinanan, Ms. Alcantara, members of the media, members of the listening and the viewing public. A pleasant good morning. We at the SWRT has intensified our overall disaster response system. I just want to give you an update in terms of what we have done. We've activated our Emergency Operations Center, which we call an EOC. Traditionally, an EOC, or Emergency Operations Center, is a physical location where incidents, emergencies, and disasters are managed. And we also support the roles and operations of the frontline workers. The EOC coordinates, provides resources, and also assists where needed. The onset of COVID, however, and the advancement of technology has allowed us to have virtual EOCs with the use of teleconferences, sites such as Zooms, Google Meet. We've also used WhatsApp, so that we are now, because of the constraints of physical face-to-face meeting, we are able to communicate and keep a pulse check of what's happening in the organization. Some of the updates that require and that we do daily: situation report. Every day that there must be a situation update so that we know what's happening in the organization to support the efforts of the frontline workers in terms of logistics, resource deployment. We've actually used it during adverse weather situation. For Southwest, we have a lot of our infrastructure tends to be indirectly impacted by flooding, so we monitor and we get situation updates as to where it's impacted, where we need to deploy resources, or where we need to move resources to ensure the best continued business operations and ensure that we continue healthcare services. At the WRC, we also utilize, in fact, all our members, executive team are on our WhatsApp chats, which is our virtual EOC, our middle and junior managers as well. Each of our facility managers in the different district health facilities, so that we're able to have an operational picture in real time and be able to deal with problems or emerging problems as it relates to all activities. The members of this team, the virtual team, we call them the Hospital Incident Command Team, and we support the efforts of the organization, whatever the need be, to ensure that business continuity in the health sector in our institution continues. It's a complex movement of parts to ensure that we continue business operations, especially in the advent of COVID and all other operational issues. Our incident commander sets the incident priority and sets the battle rhythm, and by default, our incident commander could be the CEO, or he can delegate any other members of the executive team that role and responsibility to ensure that we meet the needs of our operations response. Again, as I mentioned, each one of our facilities, we have our own sub-EOC that feeds into our main EOC at SWRH. And this EOC also interfaces with the Ministry of Health Disaster Coordination EOC, so that we liaise, pass information, provide needs assessment, needs analysis, and deploy resources as needed. Yeah, we've also leveraged the components of technology through radios and also other communication platforms to ensure that we have a seamless flow of operations and that our members have the right resources to deal with whatever operational issues that we have. And that's it for me. Thank you.
Thank you very much, Mr. Joseph. And just before we go into the question and answer segment, just a reminder, everyone, we just want you to know that we still expect and ask that you follow the health guidelines. Wear your mask over your nose and mouth when you go in public. Keep your distance from others. Stay home if you are ill. Wash your hands often with soap and water or use an alcohol-based sanitizer. Cough into the crook of your elbow. Avoid touching your face. Clean then sanitize surfaces, and of course, please get vaccinated. And we begin the question and answer segment at this point. Members of the media, we remind you please to state your name and the name of the media house that you represent before asking no more than 2 brief questions, please. And if we need to and we have time, we will come back to you. We begin this morning with AZP News, please.
Good morning. Priya Vihari, azpnews.com. My questions are for the CMO. CMO, good morning.
Hi, good morning, Priya.
I just wanted to do a follow-up on the number of deaths, hopefully vaccinated, the 57. If you can find out, what vaccines that the 56, had, in terms of the numbers, and also, can we also get maybe for the last 3 months the people who have tested positive, also what types of vaccines they have taken, in terms of the percentage, just to get a sense of that. Those are my 2 questions for now. Thank you.
So just let me clarify the second question. So you're looking at the percentage of people that are hospitalized that have been fully vaccinated. You wanted to find out what vaccines they would have had as well.
Yes.
Correct? All right. So I'll have to gather that information for you, and we can get it back to you as soon as we can. As it relates to the deaths, I am notified in terms of all the deaths that occur, and I know that it's a combination of various types of vaccines by seeing persons presenting with different vaccines when the institution sends the summary to me, but we can get the exact figures for you, bearing in mind that Pfizer and Johnson & Johnson in the country had started in terms of our vaccination program very late on compared to Sinopharm and AstraZeneca. AstraZeneca, as you remember, was the first vaccine to be used, followed by Sinopharm, and then followed by Pfizer and Johnson & Johnson. In terms of population coverage, Sinopharm is the greatest used vaccine with about 63 to 64% of the vaccines given so far are already Sinopharm. So you have to bear all those figures in mind when you look at the people that are coming out with exceptions, exceptional circumstances. You have to look at the global prevalence of use as well. All right, so we'll try to get those figures to you.
Thank you very much. And our second question comes from our second media house this morning. Guardian Media Limited, please.
Raphael John Lal, Guardian Media. This is an open question. As cases rise, what will the Ministry of Health continue to do to try to get more people vaccinated?
Okay, so I think the Ministry of Health has tried has used many avenues to try to get people vaccinated. We have created, first and foremost, access in terms of the 109 health centers, all the mass vaccination sites. We have done outreach to the homes. We have done outreaches on the weekends in different public spaces, for example, on the supermarkets, and the list goes on. At the end of the day, we have to rely on the population. It is something that is being widely offered. There's access, there's availability. We are urging the population to come forward and get vaccinated as soon as you can to protect yourself and your loved ones. So avail yourself of the opportunity as soon as you can. The centers are open. There's wide public access. So by way of the personal responsibility at this point, we have put things in place so that at least they are available. But we need the population to make the final decision as to if you are being vaccinated or not. And we are urging people to do so as quickly as you can, and especially in light of the recent surges that we're having. The best way to protect yourself and your family is to be vaccinated, and of course to follow the public health guidelines. In the short term, we are asking people to go back to the basics. Wear your mask properly, wash your hands keep your distance. And if you are ill, stay at home. We're getting a lot of complaints of people, some of them even being positive and going out to supermarkets and other places. If you have a viral illness in the country at this point in time, there's possibly a 1 in 2 chance of it being COVID, and we really want you all, once you're sick, to stay at home. That is one of the ways that we're getting spread going from one person to the next. Another issue, and thanks for the question, is that people are not reporting to the office of the CMO the cases. So as you know, the public health ordinance, there's a clause that says that medical practitioners and labs need to report positive cases to the office of the CMO. Under Regulation 13, and just to quote a sentence, a paragraph from Regulation 13, provides that where a private medical lab or a medical practitioner does such testing on a person, or a medical practitioner refers a person for such testing, the result of such a positive result should be referred to the office of the Chief Medical Officer and the Regional Health Authority. So we want to assure that is done, and of course it is an offense under the public health regulation to not do so.
Thank you very much, CMO. We have an additional question from AZP News at this time, please.
Good morning again. I know the minister has spoken more about prevention rather than cure. Sorry, prevention rather than cure. In other words, he is saying that we should focus more on trying not to contract COVID, rather than talking about having more and more resources, to treat patients. My question, therefore, is we are in the middle of a wave, and there seem to be an upsurge in cases. So I wanted to CMO, what is going to be done practically in terms of, if there are, the hospitals are overwhelmed, for example, what are we going to do in terms of, do we have enough bed space to, would you put up tents, do we have personnel? What is going to happen? What is he thinking now, and the policy of the ministry in terms of that going forward, if there is an upsurge and the hospitals become overwhelmed? Thank you.
Well, I can start the response, and I'll ask Southwest to chime in a little bit as to what is happening on the ground. So I think we have all been out here since September, recognizing that there is a spike and there has been an increase in hospital occupancy going all the way back up to the end of September, and consistently increasing. We were here in May of 2021 where we saw a spike and an increase in hospital occupancy as well, if you recall. So we have continuously increased the capacity of the parallel system by way of adding both ICU, HDU, as well as medical level beds. But the finite resource has always been medical personnel and how far that can go. In terms of overwhelming the system, it is tiers, and that's why Southwest has activated their EOC, which is an emergency operating center, because it gives there's better flow in terms of information in their RHA, so that persons communicate on a much more frequent basis, so that communication has been stepped up. It allows for mobilization of resources across different parts of the Regional Health Authority. What we had done early on in the year, if you recall, is there was a decrease in the accessibility of elective services. And we are trying our utmost best to not be there again. But resources, if resources come from a closed system, it needs to come from somewhere. So elective services, when you upscale in terms of emergency, the next thing that goes down to get additional doctors and nurses is elective surgery, for example, and elective outpatient clinics. So it's pulling and tugging on all aspects of the system, not the parallel system. The quickest way for the population to help is adhere to the public health guidelines as best as you can. I would say vaccinate as quickly as you can, but vaccination will only get us this far in the middle of a surge, because it takes some time for a person to be fully vaccinated. So we have to go back to basics, where our mask appropriately is one of the most important tools that we have. It is an invisible pathogen. I think if the country could see COVID-19 in the atmosphere, if we could see it on people around us, if we could see it on the surfaces, a lot of us will wear our masks properly. Some of us will wear 2 masks, and a lot of us will stay inside most of the time. The problem with an invisible virus is we can't see it, and we can't, sometimes even looking at a person next to you, you will think that they're looking well, but they could have COVID. because with Delta, you're getting a lot of asymptomatic spread, meaning persons don't have symptoms. So go back to the basics of the precautions, get vaccinated as soon as you can, stay inside as safe as possible if you don't have to go out for any essential reasons. Dr. Sinanan, I'll ask you just to answer a bit of it in terms of Southwest.
Okay, thank you, CMO. So at Southwest, we're continuing to increase capacity to meet demand. It's sometimes a daily adjustment, as CMO is saying, where you have to balance regular services with the needs of COVID. So that daily adjustment does occur. And as Mr. Joseph has said, we have already activated our emergency operations center. So it's a sort of pre-activation, getting everything in place, putting all supplies, resources, and systems in place for the eventuality, if, as you say, should occur.
Thank you, Dr. Sinanan. And now to Mr. Joseph to give some additional expansion on the response from the disaster coordination perspective.
Thank you, Ms. Aguilera. And just to add to Dr. Sinanan's response, we are continuing to redeploy resources to the parallel health system. We are continuing to search our initial resources. We've activated our mutual aid assistance from our partners so that we've gotten additional resources. So we are deploying resources as we can to the parallel health service to support the efforts of our frontline health workers. Yeah, thank you.
Thank you very much, Mr. Joseph. Now to questions from TV6, please.
Good morning. Question to the Chief Medical Officer. Given what you've just said, sir, how do you then find that balance in the context of the decision by the government to further open the economy and so on, the Safe Zones Initiative, and the position of the government that the way forward is getting vaccinated, but also to live with the virus, and that the government's position has been that there would not be any state of emergency or lockdown of the economy in terms of dealing with the situation as the numbers go up. At least that's the stated position, one. And two, what is the difference that the authorities would see in terms of the issue of beaches as opposed to, say, public pools, because that's been a conversation going on, as many people are saying, with so much of the economy reopened now, what's the issue with the beaches in particular?
So I think it's a long question, Joel, but both questions were answered by the Honorable Prime Minister on last Saturday's press conference. Especially the beaches was answered in some depth. So I won't want to venture into the realm of public policy and government policy. So I would leave that to the Honorable Prime Minister and the Honorable Minister of Health.
Thank you very much. And just to remind everyone, we've been talking today about getting vaccinated. For those of you who have not been vaccinated just yet, I just wanted to remind everyone about our weekend vaccination schedule. So today and tomorrow, these are the places you can go and the times that you can go to get vaccinated. In North Trinidad, we have the Paddock Queen's Park Savannah today from 9 to 3 p.m., so you still have some time to go. And tomorrow from 9 a.m. to 12 noon. In East Costat, El Dorado, Wallerfield International Raceway, and Larry Gomes Stadium. Today from 8 a.m. to 3 p.m. Again, you still have time to go. Tomorrow from 8 a.m. to 3 p.m. in Central UTT Chaguanas campus, and they're open today from 8 till 3 p.m. You still have time to go get vaccinated. In South Trinidad, we're at the Southern Academy for the Performing Arts, today 8 to 3 p.m. and tomorrow 8 to 12 noon. So, of course, we encourage everyone to go get vaccinated right now if you can. And we have no more questions from the media. We thank everyone for joining us this morning. Remember, as CMO said, let's go back to basics. And I see we just have one question that came in. My apologies. Let's go to TV6 for a follow-up question, please.
Kindly, thanks for accommodating it. Just in terms of the CMO, if you've said this before, forgive me if you'll be reminding the population, but in terms of the additional COVID doses that are being distributed to those who qualify for them, in terms of the issue of any mixing, so in other words, some persons have been asking about, let's say, if they have 2 Sinopharm doses, is it that they have to get the Sinopharm? Is it that they can get another mix with Sinopharm and another vaccine? And for persons traveling to, say, Canada or nations like that, that's been a question I've been receiving.
Okay, sure. Thank you very much, Joe. So basically what we had said before is that we were trying to do like for like in the first instance, meaning if you had Sinopharm, you have a 3rd dose of Sinopharm. If you had Pfizer, you have a 3rd dose of Pfizer. If you have Johnson & Johnson, you have a 2nd dose. And if you have AstraZeneca, you have 3 doses of AZ. So the AZ, the exception being AstraZeneca, in terms of expiry, expires on the 30th of November. After that point in time, what is recognized by the WHO is the utilization of Pfizer as a 3rd dose, for AZ. So we'll be allowing that after the 30th of November. So that will be the only exception. There's hardly any data for the utilization of 2 Sinopharms followed by Pfizer worldwide. There's very little data that suggests efficacy and safety. So in terms of AZ followed by Pfizer, AZ is also recognized to be followed by Moderna, but we don't have Moderna available in the country. So those are the combinations that we'll be accepting. Otherwise, we'll be like for like. And thanks for raising the point about Canada. So recently, Canada has aligned to the WHO EUL as well. So persons who would have received Sinopharm in Trinidad and Tobago and previously would have had to have certain requirements for entry into Canada, that has now changed. So persons have Sinopharm is now recognized by the Canadian authorities as well.
Thank you very much, CMO. And yes, no more questions at this time. So we've come to the end. And a reminder, everyone, CMO mentioned this morning, back to basics. And what are those basics? Wash your hands or sanitize your hands. And please wash your hands properly. Some persons are just splashing some water on. Wash your hands properly between your fingers, the top and bottom of your hands. Sanitize. Wear your mask properly. Watch your distance from others, and of course get vaccinated as soon as possible. As I told you, we have some locations open today until 3 p.m. Everyone have a good day and be safe.
Good day, TNT. My name is Miss Isabel Julian, and I am urging the public to please go out there and take the vaccine. I have taken the vaccine. I have no complication. I have no problem. In order for us to get herd immunity, we have to take the vaccine. I have my grandson home. I have my son, my children home. I would not like to carry the virus home and infect anyone. I am begging you, TNT. We have the frontline workers, the nurses, the doctors. They are all doing their part since 2020. Let's vaccinate, TNT.
Hurricane season is here. Are you prepared?
During the hurricane season, it may become necessary to evacuate your home. As a precaution,